Annie, bonjour. I'm always grateful to be back here in Montreal, the traditional territory of my father's family. It always feels like home. So megwich ne win for sharing this space with me today. We live in an information age where knowledge is literally available in an instant and at our fingertips. This has benefited science and research. We have made greater advancements in the last decade, even in the last 5 years, than in our entire history. But sometimes that knowledge transfer doesn't get to the front lines of healthcare. To our family doctors, to the doctors and nurses treating you in an emergency, and to the specialists in their areas of practice. To the legislators and policymakers that control access and care and treatments. I think most people think that if something really bad happens to them, that something will be there to help them. That's what my parents thought. But when my family first started navigating the healthcare system as First Nations, as people living with a rare form of the disease ALS, which is also known as Amyotrophic Lateral Sclerosis, or Lou Gehrig's disease, or MND, which is motor neuron disease. I've been known to describe it as the worst nightmare, as the monster hiding in the shadows that no one warned you about. But the horrible truth is that even if they did, there is little at this moment that can be done. So ALS is a progressive disease that gradually causes complete paralysis. It takes literally everything from you: your ability to move, your ability to communicate, eat, and breathe on your own. Yet your brain is still fully functioning and your senses are intact. So you feel pain, you feel that itch that you can't scratch, or the spider that's crawling across your face that you can't swipe away. You lie there motionless and helpless. So along with all that, it will also financially bankrupt you. This is a horrible thing that we don't talk about that much. And while you fight as long as you can, it's ruthless and relentless, stealing your life and your dreams for the future from not only you, but for your family and loved ones. So there's no cure for ALS, and it's a 100% curable disease, though. 90% of people that get ALS get it from an unknown reason, It's called sporadic ALS. The average life expectancy is 2 to 5 years. But in my experience working with the ALS community, it's more like 6 months to 2 years. And that's because of the long time spent being diagnosed with this disease that a lot of people don't know enough about. The other 10% of people living with ALS have a known cause, and that's caused by a genetic mutation, like my family. So I'm the first person in my family to openly talk about this disease. It's been haunting us for centuries, taking generation after generation of my family. So only few will acknowledge it, talk about it, even want to know about it, if you can imagine that. It's so horrible that people don't even want to know about it. And very few people in my family have even been genetically tested. The thought used to be that it was a 50-50 chance for you to get this disease, but now we know as generation and generation go on living with this disease, it gets worse and worse. And in my family, it is 100%. My dad and all of his siblings had ALS. So what my family has experienced navigating this public healthcare system can seem unbelievable if I had enough time to tell you all those stories. I'm regularly told by specialists that they have never seen a family like mine that presents the way it progresses and presents. We have been turned away from clinics. We've been told we don't have ALS. We've been denied care and support and the observation and access to any research that we deserve. I don't have time to tell you all of those stories, but I can tell you that it had fatal consequences for my father. It caused insurmountable suffering for my family when he did not receive the care and support that he needed for ALS. What I can share with you, though, is what I have learned as a patient, as a family member, as a community member living with ALS. So the value of a patient's perspective and those living alongside of us in this nightmare is invaluable. So never underestimate your own lived experience and your families and your loved ones. When my father was able to remember and share with me about his family's experience, what his siblings and that went through, I learned so much from him. And he would share these stories even when they didn't know what to call it back then. It helped me understand the disease. It helped me understand what was going on with me that nobody else would listen to. I often wonder why nobody studies a family like mine. We know so much about this disease collectively as a family, and with every person that dies, every generation, we lose that opportunity to learn more about it. So I can tell you as a patient, we are not considered a part of research in the way that we should. Like partners, like equal contributors, like the experts we are in our own disease or experience. Research starts and finishes with us. If we weren't here, there would be no research. So it should be done with us so that we can fully understand this disease. There are so many ways we can look at how powerful knowledge can be, and I often don't talk about this part of my life or me or my experience. But before ALS began to steal my father from us, he said, he would do anything to help save my life. But ALS and the thief that it is, that all changed very quickly. And he no longer wanted to talk about it or be a part of research. You know, as a child, that hurt. And as a parent myself, all I can do is do as much as I can to fight this disease and protect my children. I wish I knew about ALS earlier in my life. That would have changed so much. If I knew then what I knew now, I would have chosen a career that didn't put me at a greater risk for this disease. And even greater risk having a genetic mutation. As a mother, I think about my children. You know, I've met many parents in the ALS community that have children living with ALS. If you could only imagine that, it's horrible. It's the confusion, it's the fear, it's the anger, all rolled up together, trying to put on a strong face and find that hope in what seems to be an impossible situation. I understand why so many people don't want to talk about ALS. For me, I can't stay silent. My son is the oldest. Coming out of high school, he was one of the top football players in this country. Knowing what I know now, I should have known the risks of concussions and playing a contact sport like football. Even without a genetic mutation, there is a risk of ALS. But I have a friend, a wonderful person, a good friend of mine. His name is Glenn Love. Very appropriate for him. He's full of love. But he's just a few years older than my son, and he's currently living with ALS, a former professional Canadian football player. But he told me that even if he knew the risks, it wouldn't have stopped him from playing the game that he loved. And I know my son feels the exact same way. We are a football family. My son coaches football right now at St. Mike's College in Toronto. We love the game, but in the back of my mind, constantly, are those thoughts because of my mother and the choices that I've made for my son. Now, I could what if everything for the rest of my life. I try to live life with no regrets, right? There are no mistakes. There are only lessons that you learn. So let these be the lessons that I share with all of you today, is to use your voice. Speak up. When you know something is wrong, never give up on yourself or the ones you love. Find community, the people that are there for you when times get tough. You will need them, and they need you. And the most important thing is to keep learning. Something new every week. Talk to strangers. It's a big room of strangers, but you will make their day, and they will definitely make yours. Read books and listen to people that are different from you, because you will learn amazing things, like being here today. So why is it so important to learn about ALS? The incidence of ALS are on the rise. In the last 5 years, the incidence of ALS has gone up over 30%. So please learn about ALS. Talk about ALS. Get involved in this fight. Advocate, support, donate. And there is even a place for all of you in our research. I know I can't fight ALS alone. It will take all of us to raise awareness and cure this disease. So traditionally, just for being here with me, we would go around and we would hug each other. That's a very traditional thing. When we have a meeting or an event like this, we always set aside an hour at the front, an hour at the back to hug each other. And why is that? Because when you hug someone, you put your hearts together so that we can come and be with each other in a good way. So, from my heart to your heart, Miigwech and Niwen for being here with me today.